stools that we have. Let me introduce you to our three panelists. First, William Payne. Will is a 17-year-old senior at McLean High School in McLean, Virginia. He is known as a passionate anti-drug and anti-alcohol leader at McLean High School and in the community. Next year, Will plans to embark on a 2-year church service mission and will return to study psychology at Brigham Young University. In his spare time, do you have spare time as a high school student? Mom and Dad, does he have? He works at a local pizza parlor. He does lawn and landscaping work, and he plays basketball. Will also enjoys coaching youth basketball and is an Eagle Scout. Ladies and gentlemen, Will Payne. Next is September Johnson. Now, September and I go back a few years. She was an intern of mine in my previous federal agency at the Center for Substance Abuse Prevention, which is part of the Substance Abuse and Mental Health Services Administration. September is now an intern for us here at DEA in our section. So let me tell you a little bit about September. She is a master's in public health candidate at the Boston University School of Public Health. She earned her bachelor's degree in public health from the University at Albany. She has a background in project management and has over 3 years of experience as a public health professional in a variety of fields and settings. At the University at Albany, September was a peer educator with the nationally recognized Middle Earth Peer Assistance Program and helped develop the university's collegiate recovery program. September also has served as alcohol and other drug graduate assistant at Wellesley College. She hopes to continue her career in substance use prevention following graduation. Ladies and gentlemen, September Johnson. And to my immediate left is Sharona Robinson, and let me tell you a little bit about Sharona. Sharona is a native Washingtonian who grew up in Wards 7 and 8. She is a Ward 7 resident and mother of 2 Ballou graduates, classes of 2015 and 2019, and 2 students who attend Ballou High School in Ward 8. Sharona currently serves as the PTSA president at Ballou High School and has served on a variety of education committees, including the Chancellor's Parent Cabinet and the D.C. Advisory Committee on Student Assignment. She believes that all children deserve a quality education no matter where they live, and in her role as a Community Action Team Coordinator in the D.C. Public Schools Communications and Engagement Office, Sharona's goal is to engage more families and community stakeholders east of the Anacostia River. Ladies and gentlemen, Sharona Robinson. So the first question is going to be for all three to answer. And let me tell you a little bit about why we put this particular panel together, how we decided upon it. DEA in our section has 3 public-facing websites. JustThinkTwice.com, which is our website for teens. GetSmartAboutDrugs.com, which is our website for parents, educators, and caregivers. And our newest website, it's now 2 years plus old, is campusdrugprevention.gov, which is our website for professionals who are working to prevent drug abuse among college students. Since these are 3 of our primary stakeholders in the work that we do, teens, college students, and parents and educators, we thought we would pull together a representative from each of these groups to come up and talk a little bit about the importance of Red Ribbon Week and the importance of drug abuse prevention from their perspectives, both in high schools and in college settings, as well as being a parent and a community member. So I'm going to start with Sharona, and first is more or less a fill-in-the-blank type of question. Sharona, talk a little bit about why Red Ribbon Week is important for parents and community members.
Good morning again, everyone. Red Ribbon Week is very important because of the education aspect of it. As we saw all of the PSAs, we just have a lot of youth who are dying. And when you think about why, it's because they don't know, what it is they're putting in their bodies. They see friends thinking, it's fun, that it's okay, but I feel like that education piece of it all is what's missing. And this week, it really should be every day of the year, but this week is extremely important because of that.
Thank you for mentioning that. You'll hear that as a recurring theme throughout, is that while Red Ribbon Week is a specific 8 days dedicated at the end of October, the 23rd through the 31st, as Sharona has said, we really should be talking about the importance of Red Ribbon Week and drug abuse prevention all year long. And that's something that we certainly promote. So Sharona, thank you for bringing that up. Will, how about for you from a high school perspective?
I really enjoy the chance that it gives people to talk about this kind of thing, because it's not something that we would often talk about as high school students. No one's worried about it. No one's thinking about it, because we're young, and we all, as we see in the videos 100 times, we all think we have like some kind of invincibility just because we're young. And so this week, especially for me, and hopefully I can, there's going to be other kids who are doing the same thing. This gives us a chance to bring it up and to actually do some work in our schools to fight the idea that this isn't an issue, because it is. And once you have the the statistics, but also just like what we just watched, things that actually the visuals, you can really do some work in trying to prevent the danger that this really does entail.
So the takeaway I just heard you say is it really gives us the opportunity to talk about this issue. I mean, it gets it out in the open. We'll talk about stigma and those issues a little bit later. But thank you for mentioning that, because this is an ideal opportunity for us to talk about the importance of this issue. So September, college students.
Yeah, I'm actually going to echo Sharona. Education, this is a great week to really do targeted prevention with college students and really talk about the resources and the information available on campus and in your communities that college students can use to make healthy decisions regarding their lives. And it's a great opportunity to look back at the prevention work you've been doing all year and celebrate that work, because it's really great work, and think about your prevention efforts moving forward too.
So keep the mic, because I'm going to start the targeted questions with September. And so my entire career has been in drug abuse prevention, targeting specifically college students and preventing alcohol and drug abuse among that population. And I've heard time and time again, by the time they're in college, it's too late, right? That we need to get them in middle school and high school, which of course we do. But we know that that's not true. Certainly you can prevent drug abuse among this population. But September, I want to ask you, from your experience both as an undergrad student, you've been in peer education, now you're a grad student, what are some of the challenges the college campuses are facing around drug abuse prevention?
For sure. So there are two that really pop out to me. The first is time. Prevention work takes time, and there's a lot to be done. And as students, we know that campus professionals are really busy. We totally understand that. You have a lot going on. And as students, we have a lot going on too. We have classes, homework, internships, applying to jobs. We're trying to practice self-care throughout all of that as well. So those are two really busy schedules, and hopefully in your prevention work you're working with students as well to make that really effective prevention work happen. So you're dealing with two really busy schedules right there, but it's really important to take that time and carve it out so that your students are being continuously trained in prevention and all of the updated statistics and everything, so that they can go out and disperse that information to their fellow students as well. The other thing that comes to mind is when it comes to health information and trying to find the answer to something, our immediate reaction is to Google something and to use the internet to find our information. So when it comes to substance use, the internet is a great place to find that information, but sometimes there can be a lot of inaccurate health information out on the internet. So we want to make sure that we are taking the time to train our students to find that accurate health information and to be able to identify what is and what is not accurate health information, so that they have that skill moving forward to make the best decisions for themselves.
Excellent response, and so a bit of a not so shameless self-promotion. I mean, if you want to go on campusdrugprevention.gov, we have a section called the Student Center. And what I'm about to tell you isn't applicable just for college students. September wrote an article for us on how to find relevant and valid information around drug abuse prevention. If you go to the Student Center, you can download the article that September wrote, because I think that really will help you not only in your own work, but among your peers and work that you're doing with your friends and such in school. So if you get a chance, take a look at the article that September wrote. So Will, I'm going to ask you, why do you think some people your age in high school are using drugs?
Well, firstly, because I think they think it's fun, which is like, at some point, I mean, at some level, it's as simple as that. There are people that are using drugs for recreation. But I think at another level, there's certainly there's a drug culture at my school, and I'm sure at many high schools around the country. It seems like drugs are kind of the popular thing to be doing, and you really, really need to determine what you are, like who you're going to be, like what you're going to do and who you're going to be, and the choices you're going to make from day one in high school. Because I thought, as a freshman, I thought I had made friends who were at the time kind of committed to, steering clear of that kind of stuff. And, by senior year now, I can't, they're completely different. They've kind of given up on that. And so at some level, you really need to like try and make friends who are going to, share your kind of standards. But at another level, you also have to be willing to just say no, even if you're the only one. It's better to be right and alone than to be wrong and in the crowd. So.
Okay, thank you. Sharona, I'm going to talk to you. We've been focusing this first question on challenges and the why. So what are some of the challenges that your community, and you're in several communities within D.C.,
Yes.
But what are some of the challenges that the community faces around drug use?
So what I will say is each community does have its own identity. However, right now there is more of an issue around synthetic marijuana, more so than opioids. And I do want to say that, as we're hearing and having these conversations, the crisis didn't just start now. The crisis started back in the 80s when crack came to the nation's capital, when the nation's capital was the murder capital of the world. So, but unfortunately, because of the communities it's affecting, more white, more affluent, we're now talking about it as a crisis. But in my community, it's been a crisis for quite some time. And I do want to add just one thing from a parent's perspective to Will's comment. It's very important for us as parents to listen to our children. So I do have 3 teenagers, 15, 16, 17. So I do have to do a lot of listening. And as a parent, it is hard because we do want to jump in and sort of give our opinion. But it is key for us to be able to listen and just watch for those signs because we are the experts when it comes to our kids. So when we are seeing, them be extremely different, and as teenagers, they are going to be different because they're, growing into people and figuring out who they are. But when you're seeing, like really erratic behavior, self-loathing, just wanting to be alone, you may want to, just start having some conversations. But it's great to have a good relationship with your children.
So I'm really glad that you mentioned about every community being different. We've known this in prevention for the longest time, that you cannot take a cookie cutter approach to prevention. What's going to work, say, in Ward 8 may not work in Ward 5. It may not work within neighborhoods within Ward 8. Every neighborhood is different, and certainly as a native New Yorker, you look at New York City, for example, a 3-block radius is very different than 3 blocks down the street. And so it's really important to make sure you know your community and know the issue that they're facing. You started, I'm going to have you keep the mic, you started talking a little bit about talking with your kids about this. So as a parent, what are some of the challenges that you face in actually trying to talk to your kids about drugs?
Well, to be honest, and I'm probably going to be not the norm, but I don't really have a challenge when talking to my kids because we talk about everything. I am that parent who, we have a very open relationship. When something is bothering them, I'm listening. When they know when something is bothering me, I'm going to talk to them about it. So it's just really, again, important to, have that understanding. And with the prevalence of social media right now, there's just a lot pulling at kids. And, unfortunately, you may have a social media persona, then you may have a home persona, and then a school persona. Thankfully, my children are the same no matter what, because, I've just made it very clear to them that who you are is who you are. You can't, change who you are just for one group of people or one moment in time. That's who you are. Like, you are your brand, basically. So, I don't have that as a challenge, but I'm not going to say being a parent isn't a challenge.
Absolutely. Let me ask you, we know that one of the primary protective factors for parents is setting expectations. So as the mom of 3 kids, did you set those expectations, this open communication you have with them very early, and it's just continued as they grew older?
Yes. So I actually have 4 kids. My oldest is 22, but
You still
yes.
talk to them and
Oh,
tell
absolutely.
them, absolutely. You never stop being a mom.
Never. And it has been very important, just from them being young. We've talked about everything. They've been encouraged to do different things. Like, my 17-year-old is in her first year at the University of Miami, and a lot of what she was doing here as a student, advocating for others, just being really involved in the community, she's even doing there. So it's just, they've just been taught to just try to be responsible citizens, responsible human beings, and to help others.
So it sounds like you've set a foundation for them early that they're carrying on in their other settings and other schools and other areas. So
I've
great,
tried.
Great, good to hear. Good to hear.
Thank
So, Will, I'm going to ask you a Red Ribbon related question. We talked a little bit about this in your opening statement, but how can Red Ribbon resonate with high school students? How can we get the message across?
I think that people their age should reach out. There's a big difference between hearing it from someone who's older and
My age.
your age, sure.
Say it.
Someone who's older and someone who does this as their job or something, and someone who's just like, hey man, I'm worried about you, and I want to help, and there's all these people that are dying, and there's all these people that are getting themselves in serious trouble and ruining their lives. It just seems like maybe people my age don't like to listen to people who are older, and so in some ways just reaching out and being there.
Yeah, well, and I'm glad you mentioned that, because we do actually know from research that while it may not seem that your kids are listening, they truly are. Parents are actually one of the top influencers on their kids, research has shown. And so that's why it's important to have those conversations with them, even though it doesn't seem that they're listening, they really are. So I'm glad that you've mentioned that, and the peer influence is certainly major, because that's another group that they listen to often. And September, I mean, as a college student, you've been in a peer education program, and so I guess that's a segue for you. Would you agree with what Will is saying, that from a college perspective?
Yeah, definitely. I think talking to peers is one of the fastest way that information spreads on a college campus, and I'm sure in a high school as well. And so really making sure, if you're working with peer educators, that they are trained so that they can dispel any myths on their campus regarding substance use, and they can provide accurate information and provide quality resources in your community. That's really important. And students have access to conversations that campus professionals just don't have access to, whether they're bus rides, library conversations, late walks at night. These are conversations that, as much as campus staff might want access to, they're not going to have access to, and having peer educators and student leaders who are trained in this topic area is really important, so that you get the good information out there.
So while you have the mic, let me talk to you about Red Ribbon Week. How can college campuses celebrate Red Ribbon Week and get involved?
There's so many ways you can celebrate Red Ribbon Week on a college campus, and it's a really great chance to make sure that you're getting students involved in your prevention programming efforts, and planning these events with them along the way. Student leaders, peer educators, campus reps are really important people to involve in this work. You could do anything from just passing out red ribbons on campus and giving out information on campus regarding the important resources and and new information and research that's come out. You can host trainings, host lectures that students might want to come to. There are so many different ways. If you want to host a really big event, a really healthy and active way to get students involved might be like a walkathon or a dance-a-thon, something along those lines. Just make sure you're getting your students involved so that they can help make that celebration a success. So
for the people here in the audience, as well as all of the people who are watching and listening via the live webcast that's actually going on right now, I think I do want to make sure that I point you to our Red Ribbon site on dea.gov. So if you go to dea.gov/Red Ribbon, one of the documents that you'll find there in the toolkit is a helpful sheet on 20 ways in which schools and communities can get involved in Red Ribbon Week. And so we pass that out as a resource, of course, of which September has mentioned many different schools and communities can get involved in. So thank you for that. Will, I want to come back to you with something in your opening statement, you talked about the drug culture. And no, McLean is not unique to this. There's a lot of drug cultures, different drug cultures all across the United States. How has the culture in high school, and of course you're speaking from your particular high school, how has the culture made drugs more difficult to avoid?
Because they're everywhere. Like I'd say, we were talking. My geosystems teacher, that's irrelevant, but one of my teachers was. She basically said, like, oh yeah, probably 20% of the students at McLean smoke marijuana, and the class laughed because the number is so much higher in reality. It seems, at least to us. Like maybe we're wrong, but I think as students maybe we're over guessing, but. Basically, it seems like it's everywhere all the time. You walk into a bathroom and kids are, juuling, which is another, big issue. But the two ones at my school, I think we're lucky that we don't have to deal with, some of the harder drugs, but we are dealing with gateway drugs, and that's equally as dangerous because it just leads you down that path. So there's a lot of marijuana and a lot of vaping at my school. So that's. I think the fact that it's become almost linked with popularity is what's so dangerous, is that, that's what kids crave, right? That as much as we, high school students want to deny that, some people say, I don't care, popularity doesn't exist, which is a complete lie. I think it's like the oldest part of your brain that denotes where your social status is, but and that is part of the reason that kids are so willing to do drugs, is that they realize that it will make people look at them differently, and so that's where it gets scary. The fact that it's fun, whatever, there's a lot of fun things that people don't do because they know it's dangerous. The fact that it gives you a little recognition from people is where it gets dangerous.
So a couple of things that you mentioned. First of all is a newer resource that will be coming out from DEA. We recognize the real prevalence that vaping has taken a hold around the country. So we do have a new brochure coming out soon specifically on vaping and marijuana concentrates. So any moment now you'll be seeing that on our website that you can download. And you mentioned the over-guessing. Yeah, they are. I mean, we can just say that. So the fact of the matter is that most students and adults, surveys have shown that most times students wildly overestimate the amount of drug use that's actually happening within the school or on the college campus. And the research just shows that if you can address that misperception and actually drive the misperception back down to reality, you actually will then drive the drug use down too. So I'm glad you've mentioned that because, if your school hasn't done a survey, you might just ask to see if they have, but I would go so far as to say, I bet that your classmates are overestimating how much is actually taking place. Their perception is that everybody's doing it. But the fact is they're probably not.
Yep.
Yeah. Sharona, I'm going to come to you with your Red Ribbon question. So how can community coalitions get involved in Red Ribbon?
So I do want to give a shout out to the Ward 7-8 Prevention Center in D.C., which is the organization I've been doing some work with, not only personally but also professionally. But it's important, again, to connect with youth around that education piece. just to make them aware of, the side effects and things like that. I do remember, especially when synthetic marijuana, was really a big thing in D.C. Amongst youth, probably maybe about 3 to 5 years ago, because you would see it looked like candy and other things. It was really important for them to get out there and to connect with the youth, which they absolutely did a really great job of doing that. So I think just more of that is key in terms of just getting the word out, and then creating youth ambassadors, I think would be, key to doing that, because as Will said, it's one thing to hear from your parent, your teacher, but it's another to hear from a peer. So I think that's really important.
Absolutely. So hold on to the mic. We're going to wind up the panel with the last question, which they're all going to get the same question. So start with you and go right down the line. So Sharona, what is one piece of advice you have, not only for our audience, including those who are here in the room, but also on the live stream? What's your piece of advice for those who want to make a difference?
So my piece of advice would be to, one, if you see a friend or family member who is, experiencing some difficulties, definitely reach out for help. I feel like we're just in a place right now where we think we can just do it all. We have to ask for that support. If you aren't involved with a coalition, get involved, whether you're a youth, parent, student, college student. I think that's really critical. And to just use your platform to get the word out, whether that's, Facebook, Twitter, just connecting with other folks to talk about the importance of, not using drugs and understanding if you are prescribed drugs to use them correctly.
Great. Okay. Will, how about you? What's your piece of advice?
My piece of advice would just be, don't do it. You can't get addicted by never doing it. You're not going to get addicted if you're not going to get hooked on whatever if you never do it once. And I guess that would entail just deciding now that this is, who I am. This is, and I said this earlier, but it's really important to me in my life. This is who I am, this is what I'm going to do, and there's nothing that's going to shake me from that. And if you just make that decision, you might see your friends, doing dumb things. That's fine, I have friends like that, but I still just say, I'm here for you, man, but I don't let it change who I am. So I would say set your standard where you want it to be, and then just go with it.
Thank you. Okay, September.
Students will help make your prevention work more effective. So make sure students and youth have a seat at the table when you're planning, implementing, and evaluating your prevention programs. Students are really your allies in prevention, and we want to see our fellow students live healthy lives, and we want to be a part of that. And if you're making a decision regarding us, we should be included in that conversation. So really make sure that you're utilizing your students, because your students are a resource.
Okay, so there are your takeaways, if I can rattle them off if I remember them. So Sharona, there is support out there. Know that support is there, and don't be afraid to ask for help and to provide help. Will had basically said, it's basically setting your standards. Know who you are and hold to your standards, and help others do the same. And then September, I've known this for a while, and as all of you in this work, have the youth voice at the table. Because youth will help to support what they've helped to create. So that will conclude our panel. Thank you so much for joining us. Please give me a round of applause up here where Sharona and Will and September. They're going to take their seats. We're going to show you a few more PSAs, and then we're going to get ready to kick off the rally in just a few minutes. Thank you again, everyone.